I'm Justin Brady from iowapodcast.com. Do you know how healthcare makes its money? Heads in beds. If that sounds problematic, it's because it is, and we're seeing the results of that play out in the economy right now. Maybe there's a fix, a homegrown fix right here from Iowa. Today, we're joined with the CEO and founder of Hy-Vee Health Exemplar Care, Dr. John Veer. Dr. John, good to see you again.
Same to you, Justin. Thanks for having me.
One of the big travesties, or models, I should say, in healthcare that is kind of maybe causing problems is this whole heads in beds scenario, right?
Yes. So, it's one of those frustrating things that a lot of the healthcare dollars get spent in hospital care, major surgeries, kind of the last place you want to be as a patient. You don't want to be in a hospital. You don't want to be sick enough to be in an ICU. But that's where the dollars from a business structure exist. And so we work really out in the primary care space trying to keep people healthy and away from those things.
Yeah, so this is interesting because the model you've built is, and we'll get into this, but is seemingly opposed to or in conflict with the traditional models. And so I have quite a lot of questions on how is this even sustainable? How does this work? But basically, you've moved away from this model, and you have a big announcement in this as well, which is you're basically moving to a subscription model. Is this exclusively? This is the direction you're heading?
That is the direction we're heading. So we've historically had primary care membership at a monthly fee and all the services that we can talk about later, but we are getting ready to transition into having all of our points of care be membership related or one-time cash pay. It's really interesting when you start looking at how functionally uninsured society is. As an individual, you may have a really good health plan, but you have a $4,000 deductible. So you go get care and you're spending lots of money out of your paycheck to have this insurance. But then you go get care and you pay a $10 copay and you're like, oh, this is pretty cheap. This isn't bad. And then you get a $500 bill on the back end from that visit because you have the deductible. So you're on the hook for the first part. And I don't know the exact numbers, but it's close to 90% of people never hit their deductible.
Oh.
That means for the entire year, the things you're paying for, you're paying out of your pocket and the insurance is never getting there. And it's not really getting used unless you're someone who's really sick or you have that once or twice a decade appendix that bursts, or you end up hospitalized for a surgery, or gallbladder goes bad, or you're in a crash on 235 or another interstate and you end up in an ICU somewhere.
So there are like two levels to this that are confusing for everybody that we'll talk about today. I'm sure there are 3, 4, 5, maybe 6 other layers that are even more confusing. You talk about PBMs, you talk about insurance, everything gets really, you talk about pharmaceutical companies, and you talk about the grants they receive to get, this stuff gets really, really confusing. So we'll keep it pretty surface level today as it applies to consumers and employers and things that actually give them value. But one of the interesting things is, how is the model you have, this subscription model, completely different? Because I'm guessing here, but the heads in beds model, you basically pay when you're injured, but your subscription model, you're paying when you're not. So are you kind of incentivized to be preventative? Is this the whole model?
Yes. So your heads in beds, I call the sick care system of the medical care industrial complex, where the sicker you are, the more frequent you need seen, the more revenue that's generated in that model. And in a direct primary care or a subscription membership-based model, the goal is that you're getting what you're paying for, which is time with the physician or the provider you're with. You're getting the preventive care review that you should be getting, making sure that you are healthy. And I've never had a problem telling patients, like, if this relationship works really well, you're going to be really healthy. You're not going to have to see me very often. You're going to, from a financial model, you're going to keep paying so that when you do need it, we're there and we have more time and we know you and the relationship is there, because the relationship has been squished down to a transaction in the traditional model. And you're going to be healthier and happier, which is what you're paying for. And from our standpoint, we can practice medicine the way it's supposed to be practiced, with time and with those relationships being built. So it's supposed to align the incentives of the patient or consumer or listener with the team that's providing the care, so that we're looking at the same direction. And how do we get you healthy? How do we keep you healthy? That's the ideal for everybody.
Yeah. Because right now, what is the average amount of time that a doctor actually sees a patient when they're in there?
The data's kind of all over the place.
Right.
You'll see anywhere from 7 minutes in a really, really busy family medicine clinic to 15 minutes. And again, how much of that time is face-to-face with a clinician who isn't typing away at a keyboard off to the side and really paying attention and spending time with you and doing a physical exam and really looking for things that they might be missing.
Now, your model is essentially you're spending a lot more time with people because it sounds obvious, but you need to spend more time with people to diagnose and to actually understand what's going on with them, because the body is complex and sometimes symptoms, sometimes we're thrown off by symptoms because this is a symptom of X, Y, and Z. But if you just spend a few more minutes with them, you'd figure out you're sending them a wild goose chase.
Mm-hmm. So you hit on a couple things. One, there is old data out there to show that time spent with the physician getting an accurate history and physical decreases downstream costs. It's a more accurate diagnosis, a more prompt treatment plan, and less shotgun approach to getting the diagnosis correct. It's weird. We want to practice evidence-based medicine, but that evidence is never part of the discussion of, hey, we should slow things down in healthcare, because that's not how the model has. I mean, healthcare is broken, but it works exactly how it's designed.
Exactly. And this is the big question, is because people are like, oh my gosh, these healthcare people are just dumb. They can't figure this stuff out. Actually, they have figured it out. Like you said, it's for many of these organizations, it's working exactly the way they want it to.
Correct. And that's from the federal payers, and then all of the insurance kind of pegs themselves off of the federal payers. So I've always described healthcare as a maze. I used to say mice, but now I say rats. The rats get put in the maze, and they're going around, and the payer's job, so the insurance company's job, is to put big chunks of cheese to incentivize behavior. Let's say it's colorectal screenings with colonoscopies 1 year. All the rats find that cheese. They make a bunch of money, move that metric up. Then the payer comes in, takes the cheese, and moves it over to another part of the maze, and the rats all scurry away, and those colorectal cancer screening numbers kind of go back to where they were, but now breast cancer screening goes up and they go get those dollars. And so there's always this perverse game of like, how do we find the money? And there's a chart that shows the amount of administrators in healthcare over the last 25, 30 years is astronomically higher than the people who are actually providing care, and the cost matches their curve.
I think the big question is, people naturally would assume that, if healthcare is working as intended and some of these medical companies are making money hand over fist and they're happy campers, how do you build a sustainable model at Hy-Vee Health Exemplar Care? How is this even possible?
So that's where we've kind of extracted ourselves out of that. And by having a membership model, it's a relationship between an individual who's signing up for our Exemplar Access membership, which is urgent care, come in, be seen 24/7, have access to somebody around the clock, get strep test, flu test, whatever, and not have to pay anything more than what your membership already has. By doing that relationship is between us, and there is no insurance company built in. We don't own a hospital system. We don't have we're not part of a hospital system, so we don't have an incentive to have those heads in beds. And we send you to the highest quality person, not someone who's just aligned with us. We want to send you to the most cost-effective provider and the best provider at the same time. So then on the direct primary care model, we have a piece where we're doing the primary care plus that access to acute sick care for coughs, colds, lacerations, those types of things. And then the last thing that we've just added is something called exemplar diagnostics. And this is for those people, and the consumers have become more educated. They want different things now than the relationship I had. I'm not old enough to be Norman Rockwell, but it was hanging in my primary care doctor's office. I always saw the Norman Rockwell pictures, and the consumers changed over that time period. And so we have this diagnostics piece, which is a much deeper dive into blood work and the possibility to go on to additional testing for those people who are really trying to get their health in order. And it's a deeper dive that insurance typically wouldn't pay for, and it's a trial with our membership plus extensive testing to then go through those results and really make sure you have a plan in place for yourself.
A lot of people are like, I don't understand why my insurance or my healthcare company doesn't cover this thing because this is preventative and isn't that good for them in the long run? And of course the answer is no, it's not actually good for them in the long run. So with this model, you're in basically the less healthy, the more unhealthy your patients get, the more revenue you stand to lose, and your model becomes less and less sustainable. So it sounds like, correct me if I'm wrong, but it sounds like you are incentivized then to keep people out of your clinics.
We are. And I'm not going to say there's any physician or clinician in town who's not trying to keep people healthy individually,
Right.
but the system puts pressure on and compresses those time spots and makes it harder to do so. But in our model, we're aligning our incentive with the patient or consumer incentive. And yes, people have said, well, you're trying to cherry pick really healthy people and you don't.
Oh,
so people
really?
will accuse the model of targeting really healthy people, but we have taken care of really sick Medicaid patients, homeless patients at Central Iowa Shelters and Services. We work there, and by having no barrier, and they can come in and get more access. So yeah, we see them more, but we keep them out of those ERs and hospital stays and rehab facilities. So yeah, we may see some of those people more frequently if they are sicker, but we're doing a better job of keeping them out of the high-end care model.
So from a 30,000 foot view, this healthcare model, some people may not be familiar with it, right? And well,
Correct.
actually, not some people, maybe. Most people aren't familiar with this model of healthcare, which is we'll charge you a subscription and our goal is to keep you healthy. Like that sounds foreign to most, but to people who are a little bit more healthcare savvy, there are some terms floating around that it might be helpful for you to break this stuff down. Like there's direct primary care, there's concierge care, there's traditional care, and then there's what you're calling subscription model care. Like what is this for a really like layman? What does this stuff mean?
So we'll start with the traditional. That's you go in, you hand over your insurance card, you get the care, you go back, you get the bill later on, and you don't really know what care costs until after it's already been delivered.
True. Yeah.
The concierge version takes that model and they add a monthly or annual fee on top of that, and they still bill the insurance. So they're kind of getting paid twice. It's really about access and convenience. And then direct primary care is a subscription-based model, which is what we started on. We've just added some nuance to it to expand it out. It is outside of the insurance. So we are charging $89 is our full tilt price, less for the employer groups that we partner with off of volume. And then our access for just the urgent care is at $49, and you pay that once a month and you come in, you get care, and you don't have to worry about some bill coming back later. Everything that we provide, whether it's labs that we do on site or send out, medications we dispense, which is something the Board of Medicine allows in the state of Iowa, as well as plain imaging. We do x-rays in-house as well. Those services are all included, so you don't get a surprise at the end. You know, okay, I'm going to spend $89 a month, and I'm going to get all this care instead of going and getting the care and waiting to see what it costs you.
Are there any scenarios when people don't know what they're going to pay? Like at Hy-Vee Health Exemplar Care, someone comes in for a scratch or a minor rash, they're going to still pay that subscription per month. But what if they get smashed into by 80 semis and they come in 20 pieces? Is it still going to be the same price per month?
Well, so that person, hopefully if they're smashed like that, EMS goes right past our door and takes them to an emergency room.
Yeah, well, sure. Good point. Okay.
And we talk to everybody about, like, there are people who have no insurance, and we are a safety net that allows people to pay to get care that they otherwise can't predict what the cost is going to be. They budget and they get the care from us. They keep themselves up to date on prevention, flu shots, things like that. We still encourage people, and we work with employers to say, yes, you need insurance. You should have insurance because you could be hit on 235 or on 80 and spend $500,000 in an ICU for a month. And so you really have to have that layer. But I liken it to car insurance. So from all your posts, for those who don't know, you have a Tesla, right? And you don't have to pay for gas. That's you picked the outside model, and you have a difference that you benefit from. But if you take someone who has a combustible engine and they put gas in their car and they get their oil changed and they rotate their tires, State Farm, Progressive, whoever their insurance is, you're not sending those costs to the insurance company.
Right.
So all of the preventive maintenance you're doing on your car, you're paying for out of pocket. Insurance is there for when someone sideswipes you and totals your car and replaces it. Well, if you go back 40 years, that's what health insurance was. People paid for their primary care just like they would a fill up on your gas or an oil change, and over time, insurance started to pay for all of that.
Right.
And what that did is that bloats the cost. So if every tank of gas that someone who needs gas, if that was billed off to, if that went off to the insurance company, suddenly we'll say $100 a quarter or whatever. I'm terrible at what car insurance costs, but it would be exponentially higher if they were footing the bill on every bit of gas that you were putting in. So that's what this is doing. This is putting insurance back where it's supposed to be, which is for catastrophic care. Routine preventive stuff shouldn't be hard.
Right, because you're dialing the clock back about almost 60, 70 years at this point to reset things to the way they were originally intended to work. And like you mentioned, if you're relying on your insurance, and this is another layer that gets people super confused, because people have conflated insurance and healthcare. They're almost the same discussion these days. They have totally different functions.
Yep.
And those the conflation of those two functions is what's led to a lot of confusion with how healthcare is billed. But basically, you're rolling the clock back about 60, 70 years, and you're saying, look, health insurance, what you're saying, people should still have it, but it should function like insurance is supposed to function, which is if you have the catastrophic event, that is when health insurance kicks in. It's not to cover all the little things that are happening all the time, because that's what's driving everyone's rates up, and that is what's making healthcare more expensive. So this makes it more manageable and understandable. And like you said, you're not getting sneaky bills from the doctor, the facility, the insurance company, and then whatever other people are in there.
Well, it's funny because we've had people at employer groups that we work with, and they'll be like, well, why is our insurance going up this year? And they're like, I didn't spend anything. No, but Sally Sue down the hall and Joey spent astronomical amounts in healthcare this year, and you're now going to pay for next year to make up for that. And so everyone's kind of stuck in the same boat, and this is a chance to kind of break it out, and employer groups can use it as a cost control to help prevent some of those big spikes in premiums.
Yeah. Side note, one of the things my brother is in healthcare, and one of the things he talks about is like, due to all the insurance and regulatory layers, sometimes it's actually cheaper to pay cash than to go through your insurance. But despite that fact, a lot of people still say, well, if my insurance doesn't cover it, I'm not interested. And he's like, if you run it through your insurance, you will pay more. But it's just like the insurance discussion has, people's understanding of insurance has stopped any meaningful discussions in healthcare.
Correct.
As a side note. But you have mentioned this a few times, and I think this is a good note to end on, which is you've said employers. So people are like, oh, okay, I get it. I pay a subscription. Everything's manageable. My entire family knows what we're paying per month. We can go see you whenever we want. Your clinicians are incentivized to keep us out and keep us healthy all the time. Great. Dr. John, sounds great. How does the employer, is this a benefit that some employees is this a benefit that some employers are offering their workforce? So like
it is.
CEOs, CHROs are saying, hey, everybody, if you work here, Hy-Vee Health Exemplar Care, you just get that service?
Yes. So we have 55 current groups that we are working with across the 5 states that we're in. And absolutely that's it. And we've gotten comments back from employees who say this is the only real benefit my employer gives me. And they're saying it as this is the only benefit because it doesn't cost them anything.
Yeah.
So the employer chooses to do this. And again, we already started the conversation with you being functionally uninsured because you have this big deductible you're going to pay. But if they sign you up for this membership and you come into Hy-Vee Health Exemplar Care, you get the care you need. It doesn't cost you anything as the employee. You go about your business and you don't avoid care because you're scared of the cost. You actually engage more and you get healthier, and you're a healthier workforce for the employer. And the employer knows here's a fixed defined contribution I'm paying on this piece, and I now don't have to worry about my employees avoiding care, being scared to go to the doctor to get diagnosed with something and cost money. So it is a true benefit in that they come in, they get care, they're charged nothing else to see us. And if they need elevated levels of care, we then send them to the appropriate resources there, but they have someone walking with them in that journey. And so it's a real win for employees when their employer picks it.
When I started working with an HR brand years ago, I had zero visibility into how health and even mental health, the negative effects they have on workplaces. I didn't even make that connection. But when people are out all the time because they're sick, and that is such a drain on the organization, because you hired them because they have a beautiful brain and you want them doing beautiful work. And if they're sick all the time, even if they're in the workplace, they can't focus on good work. And so it is an incredible benefit, especially, I mean, are you seeing, I guess this is the last question.
Sorry.
Are you seeing then a lot of organizations use Hy-Vee Health Exemplar Care as kind of a talent acquisition and a talent retention tool to keep great talent in their organizations?
Yes, we are.
That's
and
crazy.
It's actually kind of funny. We've had a couple employer groups who, actually one of our very first ones was a larger employer, said, hey, we're thinking of switching. And the employees went back to the employer and said, don't you dare. We love this benefit. And they said, oh, okay, well, yeah, we'll keep it then, because it really is something that can differentiate you as an employer with your employees.
Dr. John Veer, the CEO and founder of Hy-Vee Health Exemplar Care. If people like what they're hearing, whether they're an individual or family that want to sign up, or whether they're a CHRO or CEO that wants to sign up, what's the most direct path for them to reach out to the company and the organization?
Go to exemplar.care, C-A-R-E. There's all sorts of information on our website. And otherwise, you can email me at jon@exemplar.care.
CEO is giving out his contact information. That's crazy.
Absolutely.
I appreciate that. And I'd also like to say at iowapodcast.com, we are absolutely thrilled to be collaborating with you to get great information out to our audience. So thank you for that as well.
Thank you. We're excited.